Welcome back to the show. We're going to stay on the theme of mental health, and we have so many wonderful organizations here in the city, including the Youth Services Bureau, who have some fantastic services and programs around youth mental health. And I'm joined by the Coordinator of Youth and Family Counseling, YSB Mental Health Services, John McKnight. John, welcome. Great to have you here.
Thank you for having me.
We're going to concentrate on mental health, but YSB, the Youth Services Bureau, I mean, it's been around for many, many years and offer a lot of different programs and services. John, just give us a bit of an overview for us.
Sure, yeah, we've been around for a little over 60 years at this point. So in addition to mental health services, we also offer housing support for youth facing homelessness. We offer employment support, not just for youth, but for adults as well. And then, of course, as you know, we offer mental health services.
Yeah, tell me about those services. What can people expect when they get in contact with YSB?
Yeah, so our aim really is to be responsive and accessible to those looking and seeking mental health support. And so for us, that means offering a wide variety of services that people can access when they do need help. But accessible also meaning that we have a number of different ways people can access the service. So, you know, one of our most popular ones is our 24/7 crisis line. That, of course, is available 24 hours a day, 7 days a week, where people can really reach out at a place on their terms. Where we notice people calling, whether it's from their home, from school, parents calling on work breaks, over the phone. We now have a chat service as well where people can message in to chat, where people can really just get that support when they need it at the right time. But accessibility also means we have a walk-in clinic as well, where people can access in-person counseling on a weekly basis.
Yeah, and who's at the end of that line? Who's at the end of the that chat line or the phone call or the in-person?
Yeah, so for our crisis line, we have our crisis team that's there who are trained professionals to pick up the phone and deal with a whole variety of different types of issues that people are facing. And so whether that's conflict in the home, with family, difficulty with school, suicidality, whatever that might be, is the crisis team is there and accessible to do that. And they're employees of Youth Services Bureau. And at our walk-in clinic is all of our walk-in team is trained psychotherapists, where they're available to meet people in person twice a week, where people can literally just walk in off the street and access the support they need.
John, you touched on some of the reasons why youth are coming and approaching you and using the services. Are you seeing some common themes these days?
Yeah, I think one of the themes we're noticing is an increase in the complexity of issues that people are dealing with. And so, you know, for some that might mean impacts of trauma, for example. Some that might mean dealing with some self-esteem issues that from there start to get in the way of eating habits, which from there might move into eating disorder. So the complexity is really starting to grow is what we're noticing with youth and families. And so for that reason, again, we want to be accessible as soon as possible and responsive.
Is the need growing? We just heard from Leslie at the Distress Center, and she's talking numbers with us, and those numbers unfortunately continue to grow. Yeah,
so for us, the need, there's growth there for sure. Last year, our crisis line served upwards in the neighborhood of 5,000 youth and family throughout the year, and our walk-in clinic alone, which really, again, is available 2 days a week, we served about 1,000 youth and family. But when we start to think about that, it also means that the crisis line is being really responsive, where they're able to help people manage and navigate where that's all they need, and they might not need the walk-in clinic per se. So we're happy to see them doing a great job.
Well, what's the feedback? What's the response been like? Because you guys, you're changing lives for young people in the community.
Yeah, so the feedback and response has been great from the community, and people certainly welcome the opportunity to be able to call in, do the chat, or have that option to come in person if needed.
I think the difficult thing for youth oftentimes is actually making that phone call, or coming and being in person. What advice would you give to a young person that is struggling and is reluctant to reach out?
Yeah, so for us, we want people to think of reaching out for support as a whole variety of different things. So we're there as well, for sure, with the services that I just described. But people can be thinking about others in their lives, such as friends, families, teacher, guidance counselors, and if it is us that they're going to be reaching out to, is what we would want them to be hearing is that they're going to receive that support and intervention right away, where we're going to get the ball rolling, where they can make decisions on what that next best step could be for them to get support.
John, I know you're involved in Let's Talk Day, YSB. Tell me about your involvement.
So for Bell Let's Talk, that goes back our relationship quite a number of years. So we've been really fortunate to be involved with Bell Let's Talk. When our walk-in clinic opened upwards of around 10 years ago, Bell Let's Talk was there to provide the funding available so we can open the doors, and then for here on in, keep those doors open so youth and family can keep coming in to access our support. But they're involved on a regular basis throughout the year, not just on Bell Let's Talk Day.
Yeah, and I'm glad you mentioned that because it is important. I know that the day itself gets a lot of attention, but it's something that has to be talked about more and more. We've come a long way, but there are still challenges, and the taboos are certainly still out there. What about funding, John? Where do you get your funds at the Youth Services Bureau?
Yeah, so a good portion of our funding comes provincially. So we also have, we're very fortunate, we have a great team that works at the YSB Foundation. So we have a foundation that's been built and put in place where they're out throughout the year, constantly with the community, raising awareness, putting on events, and the community itself has been really responsive to support with providing donations that allows us to keep these types of services that we're talking about open.
Right. Do you have volunteers that help with the Youth Services Bureau? Are you looking for? Are there opportunities out there?
Yeah, less so on the volunteer end.
Okay.
Most of our positions are people that do work for us and make a career out of it and find a place that they can call home to work at. So it is mostly our employees.
Yeah, which is, that's important too, right? Because sometimes when people reach out, they want to make sure that the person at the other end, is a professional. Obviously, the Distress Center has a very intensive, training program. But I think, the Youth Services Bureau, it's certainly what sets you apart. If somebody wants to reach out, John, what's the best way for them to find out the resources you offer at YSB?
Yeah, so a good first step could be to connect with our crisis line. So if they call our crisis line, they're going to be provided with the option to be connected with a crisis worker right away, but they'll also be provided with an option to connect with a service called One Call, One Click. And what that is really it's a number of community partners that have come together to provide a way for families to give one number a call and learn about what's available in the community.
Appreciate the time. Thanks so much for joining us, John. We'll be right back.